Hi everyone, welcome back. In the previous videos, we discussed about how cancer starts and what are the things that increase your risk of getting cancer. Now today, I'll talk about screening. So what is screening? Screening is basically when we do examination and some testing so that we check if you have early cancer. And it's usually done on people who have no symptoms at all. No symptoms, no sign. You're completely fine. But we test you because you might be having a very early stage of cancer. Now, today I'll tell you about screening for colon cancer. And then on the next video, I'll talk about breast cancer, which is what you hear about more often, especially in the coming month of October. So colon cancer screening, who is it done for? Colon cancer screening is done for people who are at the age of 45 or above. So the guidelines are different in different countries, but in Kenya, we start screening at the age of 45. So anyone, man or woman, whether you have a family history or any other risk factor or not, so long as you're at the age of 45 and above, we start screening you for colon cancer. So how do we screen for colon cancer? First of all, we usually do something called fecal occult blood testing. What does that mean? So it means that we take a sample of your stool, and that is, sorry to say, poop, and we test it to see if there's any blood in it. That's because colon cancer, it tends to have some bit of ulceration that can give you a bit of bleeding. And the bleeding will not be so obvious, so we check that blood in the stool. And that one is done either every year or every 2 to 3 years, depending on the type of testing that's done. Now, the other test that we do is called a colonoscopy. A colonoscopy is when a camera goes into the colon and we directly look inside the colon to see if there's anything that looks suspicious. And if there is, we take a sample. That means we take a small piece of it called a biopsy, and we send it to the lab to see if it has cancer or not. That one is done every 10 years. Now, I've said we start the screening at the age of 45 and above. However, there are some other people. For instance, if you have a family history, that is a sibling or a parent or a child who's had cancer, normally a sibling or a parent. So for you, we start screening 10 years earlier than the age at which your relative was diagnosed. What does that mean? So let's say if your parent had colon cancer at the age of, let's say, 50, that means we need to start screening you at the age of 40 instead of 45. And if, let's say, they were diagnosed at the age of 70, that means we'll start screening at the age of 45 still. Why? Because we either screen starting at the age of 45, or we screen starting 10 years earlier than the age at which your relative was diagnosed. Whichever is earlier, that's what we go with. There are other conditions, people who have some known genetic mutations in the family, their screening protocol is quite different. Now, I will not go into those. What I'll say is, in conclusion, we screen for colon cancer using the stool test, which is done every 1 year or every 2 to 3 years, or the colonoscopy that's done every 10 years. So if you need any more information or you'd like to know if you qualify for colon cancer screening, please speak to a general surgeon or an oncologist. Thank you for watching. We're going to talk about breast cancer screening on the next video. Stay safe and stay healthy.